We would like to inform you that the Union is a secretariat of the Leadership Summit on Tobacco Control, a virtual event to take place 6 and 7 of May 2021. The registration to the summit opens in January 2021. The scientific program will feature Michael Bloomberg, Stephen Donnelly, Minister of Health of Ireland, and other heads of state and national and subnational governments, prominent global health leaders, the scientific community, and civil society. The full program will be launched in January 2021, and more information can be found at wctoh.org.
Dear colleagues, dear friends, dear participants, to the 51st Union World Congress on Lung Health. Welcome to this important plenary and to the Congress, a Congress that shows how a scientific society like the Union advocate for the patients suffering from the consequences of air pollution and the adverse impact of natural disasters and man-made products, such as tobacco and nicotine on environmental determinants of health. Ladies and gentlemen, the coronavirus showed us that a society that brings the know-how on the epidemiology, infectious diseases, and lung diseases allows for efficient and cross-within the discipline disseminations. The pandemic also showed us how the Union and other organizations brought people from different countries, from different areas, from different regions together as COVID-19 educators. Our respiratory family, like the community as a whole, lost members. We lost members in great numbers. Those who lost the battle, to COVID-19. Those will indeed be honored during this conference. Ladies and gentlemen, smoking kills 15 times more people per year, every year, than Corona in 2020. The fight for lung health must include addressing the adverse impact of these major contributors to lung health issues in an effective manner to protect the health of all people, and in particular, the most vulnerable. Again, in industries profiting from these practices and products should not continue business as usual with the minimal consideration of these huge problems to lung health and the vulnerable populations.
Hello, my name is Jorgen Vestbo, and thank you for giving me the opportunity to talk about e-cigarettes. First, these are my conflict of interests. None of them are related to smoking, smoking cessation, vaping, or anything to do with e-cigarettes. My title is New Generation Tobacco and Nicotine Products. Are they harmless? And probably not surprisingly, you will know that I'll end up saying they are not harmless. But before then, I'd like just to give you a picture of what we're going to go through in the next 15 minutes. I'll talk a little bit about types of products and to whom, talk about a little effects on respiratory health, and I'll end up talking about e-cigarettes and harm reduction, which is a big thing at the moment, the debate about harm reduction. First of all, let's just realize that this was something of the past. Smoking is on the decline. This was something of previous generations, and this is not going to be the picture of the future. There are very clear signals that young people do not find cigarette smoking attractive. Cigarette smoking is on the decline. We all know that, and the tobacco industry and vaping industry, they know that as well. So they have had to find other ways of selling products that can satisfy a craving for something you can use to relax, and also for companies to make money on producing a product that will make people nicotine addicted. So there are different types of products on the market. There are those that are tobacco-based and heated. That's heat, not burn, heated tobacco products. Then in the other corner, we have no tobacco, nicotine-based and heated e-cigarettes, which I will talk most about. But there are also unheated products, such as tobacco-based unheated product. That's smokeless tobacco, stuff, and snus. And then there are no tobacco, nicotine-based, but unheated product. Most well-known are the nicotine pouches to put in your mouth. Most of my presentation will deal with e-cigarettes. These are the latest generation e-cigarettes, new ways of making people nicotine addicted or to relieve their nicotine addiction if they want to leave cigarettes behind. At least that's what they say. This is Juul, one of the most sold products, and you can see it's slim, it's nice, it's very Apple-like, and it works with a device in which you put pods. They are called pods, in which you have different flavors. There are also other types of late generation products, and you can see that they're all different from the e-cigarettes we saw in the beginning of the e-cigarette epidemic, where they were clumsy containers filled with fluid, big, and not easily put in your pocket. These are much more fashionable. Now, of course, you need to create a market, a customer base, and not surprisingly, a lot of the vaping industry is either owned or supported by the tobacco industry, and they have a decade-long experience in advertising. So they are good at advertising and creating a customer base. If you look at the ad on the right, you will notice that it has a striking resemblance to the old advertisements using the Marlboro Man, one of the most well-known icons in the advertisement world. This is an advertisement for Juul. You could wonder if this is really the way you want to focus on middle-aged smokers who have problems quitting their cigarettes, or whether this is a way to attract young people into a new habit of vaping. I have no doubts. It can get even worse. There are vape fluid advertisements and packages where it is clearly made to resemble bubble gum on the left, ice cream on the right, and I find that completely incompatible with good advertising. This is clearly aimed at children and adolescents. Does it work? Well, it does indeed. We must say that the vaping industry has created a strong customer base, mainly of young people, but of course also of older people who replace at least some of their smoking habit with vaping. If we look at the numbers from US high schools, you can see that 31% of high school students in the US have used some sort of tobacco product, and the vast majority of these have used e-cigarettes. This could be a good thing if it meant that there was a strong decline in smoking, but as I will come back to, that doesn't seem to be the case. Well, what about the effects on respiratory health then? I think we should split it in two. There are the acute effects and there are the long-term effects. And unfortunately, I would say most of the focus has been on acute effects. We all remember last year, 2019, where there was a sudden epidemic of acute lung injury brought by e-cigarettes or vaping products, the E-Valley. It is quite clear that a lot of the harm for these acute lung injuries came from e-cigarette fluids containing either cannabinoids or vitamin E, but we still do not fully understand the underlying pathology of this acute lung injury. It's also poorly characterized, but we still see it. I'm actually much more concerned about the long-term effects. In my daily life, I'm a chest physician. I work with COPD patients, and we know a lot about what smoking does to the airway. We know that one of the things it does in creating emphysema is that it increases breakdown of matrix in the lungs. And this is a study where investigators have looked at human cells taken from human airways. This is not an animal model. This is from humans. And what they've done is they've compared non-smokers to smokers and vapors, and they've looked at the release of two important enzymes, elastase and matrix metalloproteinase 2, two enzymes that are involved in the development of emphysema. And when you look at the levels of these enzymes in bronchoalveolar fluid, it is very difficult to believe that vaping should be so much better than smoking when you look at long-term effects. So I think we are just noticing the beginning of a vaping-induced epidemic. This is important because usually we talk about smoking changing to vaping to reduce harm. We see that advocating the use of e-cigarettes should be a harm reduction initiative. Of course, reducing harm is what we all want, but in this case, the concept is flawed. I'll come back to that. And I think we must avoid talking about harm reduction when we talk about e-cigarettes. There are 5 arguments that are usually brought forward, and I'll just address each of them briefly. The first one is that smokers cannot or will not quit smoking. Now, this simply isn't true. The majority of smokers want to quit, and a high proportion dislike being dependent on nicotine. And actually, already those who smoke today smoke less, they are more motivated to quit, and less dependent. So they will and they can quit. Secondly, alternative nicotine delivery products are highly effective as smoking cessation aids. This is something that we're all led to believe, but there's extremely little evidence supporting that that is the case. And to be fair, none of these harm reduction products have ever been approved for smoking cessation. Often advocates for this argument, they refer to a paper in the New England Journal last year where patients were randomized, or rather smokers were randomized, to either e-cigarettes or nicotine replacement therapy. And after a year, they could show that the abstinence rate from smoking was higher if you were on e-cigarettes than on nicotine replacement therapy. Of course, that's good news. But if you read the paper, you will find that actually after this 1 year, 80% of those who had quit on e-cigarettes were still vaping, and 31% of the smokers who gave up but restarted smoking still vaped, so they were actually dual users. Now, if you quit on nicotine replacement therapy, you do not become long-term nicotine addicted, and you can see that the numbers are much, much lower. So although people stop smoking, they do not get rid of their nicotine addiction, and that we know is a strong risk factor for them restarting smoking later. Also, if it was so effective, we would expect smoking to go down much more rapidly. You can see in the blue graph, this is tobacco use in US high school students. It's been dropping consistently over the last 20 years at a constant rate. And you can see from 2012, when e-cigarettes really made their entrance to high schools in the US and have increased dramatically, we do not see an increased drop in tobacco use. In fact, it seems that it's almost leveling out. This was not what we would expect if e-cigarettes were good at making smokers quit or make them more unlikely to start. Third argument, smokers will replace conventional cigarettes with alternative nicotine delivery products. They do not. They do briefly, but many e-cigarette users continue to smoke or take up smoking again, and there seems to be no significant reduction in their consumption. Dual use is frequent, and it adds no benefits at all to cigarette smoking on its own. Alternative nicotine delivery products are generally harmless. I think I already showed you the picture on elastase and MMP in bronchoalveolar fluid. And in general, almost all independent studies indicate potential harm. So we don't doubt that there is harm. We're just uncertain about the degree of harm. And actually, we have no evidence at all on long-term health effects of using e-cigarettes in normal people. And that's the problem, because now we are being told by the vaping industry they don't harm long-term, just as the tobacco industry told us about smoking 50 to 60 years ago. Finally, the argument is that without cigarettes, e-cigarettes, we cannot curb the tobacco epidemic. This is wrong. Actually, from a public health perspective, smoking cessation is one of the big successes in public health. And we know that in the countries where strong tobacco control measures have been put in place, there's been a rapid decline in smoking prevalence. We need brave leaders to implement evidence-based effective tobacco control measures, not e-cigarettes. And there are risks in taking on e-cigarettes as harm reduction. It may be that smokers do not use the evidence-based smoking cessation services or smoking cessation pharmacotherapy, but put their confidence in e-cigarettes with little help. So even if they are less harmful than conventional cigarettes, they may still do no good. And in fact, harm may be the result, not harm reduction. Others have taken this concept on board. The World Health Organization this year had a World No Tobacco Day where they emphasized that the aim was to protect youth from industry manipulation and preventing them not just from tobacco use, but also from nicotine use. They wanted to debunk the myths and the manipulation tactics employed, and they wanted to make young people aware about the tobacco and nicotine industries, because the vaping industry is working with the same methods as the tobacco industry. Now, my conclusions are therefore that e-cigarettes, they may seem safer than cigarettes, but then again, what is not safer than cigarettes? We should all worry about the widespread use of e-cigarettes, and especially about the long-term consequences of vaping. Finally, in fighting the tobacco epidemic, e-cigarettes are not part of the solution, they are part of the problem. Now, I've been very happy over the last few years to work as the chair of the Advocacy Council of the European Respiratory Society, and I'd like to acknowledge the help of both the Office of the RS, but also others who have been very closely linked with our efforts to prevent e-cigarettes from rising further and to debunk the myths about harm reduction. I hope that we can all share our concern and that we can all come out with clear messages about our position on vaping. Simply don't. Thank you very much for your attention.
Hello, and thank you for inviting me to be a part of this session. What I'm going to do is talk about landscape fires on Earth, give you some background, talk about the smoke they give off, relationships to lung health, and then in keeping with the theme of this session, I'll reflect a bit on greed and inequality in our future as it relates to landscape fire smoke. So first we're going to start with this map of the world here. And what it shows is the distribution of where fires burn on Earth. And it's a compilation of data over a 10-year period from the Global Fire Emissions Database. And I want to point out a few things with this slide. One is that there's only very few places coloured white, like the deserts and the Arctic, where there's no vegetation, but basically anywhere there's vegetation on Earth, there is fire. The other place where there's white patches is in South America and Central Africa. And the reason is that tropical rainforests are so wet that they very rarely burn in nature. So that's another reason for big white patches on the landscape. But as you can see with the different colours, the pale green and the blue are areas of savanna and woodland, and that's grassy country, open trees, highly fire adapted. That's the most biggest areas on the planet where there's fires. And then the orange stands out, particularly in the Northern Hemisphere. They're dense forests and they're forest fires. Yellow refers to agricultural burning and smoke from burning crops or from more traditional forms of slash and burn agriculture. One of the most important ones is the dark green. And you can see that's clustered around central tropical areas. And that refers to deforestation fires. And these are fires deliberately set by humans to clear rainforest, to repurpose it for things such as soybeans or palm oil. So they're in a category of their own, deforestation fires. And you can see it's around the equatorial areas in Southeast Asia. Okay, so knowing where all the fires are, it's possible to work out emissions from different types of vegetation, and then combine that with satellite data about air pollution and with meteorological models, and come up with an estimate of the contribution of these fires to the overall burden of outdoor air pollution. And this is a map from some work my team did about 10 years ago now. It's still the most current estimate, although there are other teams working on this as well. And this shows the distribution of smoke, particularly PM 2.5, particulate matter within smoke, the contribution to the annual average, and this is an average over a 10-year period. But you can see there's some places where it's red or very dark orange, where it's between 10 and 50 micrograms per cubic metre as an annual average over and above other sources of air pollution. And that's particularly around the equators, and then in other parts it's a much smaller contribution. Overall, an important contribution to the total burden, though. And we know a lot about ambient air pollution from all sources. So landscape fires are just one of many sources of PM 2.5. And just by way of example, there are a few meta-analyses here. showing relationships that are pretty well established now, but ambient particulate matter and lung cancer, infections, respiratory infections, including TB and childhood pneumonia. And of course, the Global Burden of Disease Project makes annual estimations of deaths and years of life lost attributable to environmental risk factors, including PM2.5. So I'm going to reflect now on where landscape fires fit into this, and landscape fires and lung health in particular. So here's a slide of a close-up of a landscape fire, combustion of hydrocarbons like leaves and wood, and with a source of energy and with a source of oxygen that combusts, gives off energy and gets converted to carbon dioxide and water. And that's, whoops, pushing the right. That's what you would get. All of the carbon in the wood would be converted to carbon dioxide with 100% efficient combustion. But we know that combustion is never 100% efficient, and particularly where you've got smouldering, where you've got solid fuels. So very common with any kind of vegetation fires, you have a lot of incomplete combustion and you have a lot of products of incomplete combustion. And those products are really what drives the health impacts. And I won't go into this in detail, but it's a list of the major compounds and groups that you will see in landscape fire smoke. The main one highlighted in yellow there being particulate matter, compounds of carbon, solid or liquid that are suspended in the air, very well documented health effects, but then a whole suite of these other products of incomplete combustion, which are known to be pro-inflammatory, reactive oxygen species, carcinogens. The more smouldering and incomplete the combustion, the more you're going to get of these toxic co-pollutants, along with the PM2.5 in fire smoke. So what does this mean for lung health? And the literature is emerging about PM2.5 that comes from landscape fire smoke compared with background PM2.5 that can be emissions from industry, transport, windblown dust, sea salts, all sorts of things. So as I've mentioned, you can compare the composition. The composition's changing all the time. There's ongoing chemical reactions, but we do know there's a lot of these other species, and we do know that there's a far greater contribution of the very small, fine and ultra-fine size classes. And both these things would imply that there'd be greater health impacts. We can also look at meta-analyses of fire smoke only studies, and we can look at studies that have directly compared PM from the two sources. And as an example, here's some meta-analyses. The first column shows outcomes for asthma, emergency attendances and hospital admissions, where the source of PM is just fire smoke. And the second column shows the same outcomes from some meta-analyses from background air pollution, where it's not fire smoke. And as you can see, the effect estimates are higher, around 3 times higher in the context of landscape fire smoke. But they're different studies, different settings. More useful are studies that are done as direct comparators. And there's a growing body of evidence about this, both toxicological studies and epidemiological studies. They're all telling us the same thing. So toxicological studies looking at markers of inflammation in cell lines with identical concentrations of PM2.5, but sourced from either landscape fire smoke or background, and studies in mouse models of inflammatory infiltrates in lungs, both show much greater inflammatory effects when it's landscape fire smoke as the source of PM2.5. And similarly with epidemiological studies that have used the same population, same statistical methods, same outcome measure in terms of asthma, ED attendances, hospital admissions for all respiratory problems, and ambulance call-outs for breathing difficulties, again, all have higher effect estimates, often 2 or 3 times higher, not always, but the pattern is the same in that there's greater respiratory impacts. And here's just an example, just published in the last month or so, of asthma emergency department presentations, and the dark circles show wildfire smoke PM2.5, a rise of 10 units, and the effect estimate associated with that. And then in the absence of any particles coming from landscape fire smoke are the open triangles. And that's a clear example of the differences in this particular study. So to summarise that, we can be confident that the acute impacts of increased PM2.5 from landscape fire smoke are greater or worse for lung health than equivalent concentrations of PM2.5 from non-landscape fire, smoke or biomass combustion sources. That's acute impacts. There's actually not really enough evidence and studies being done for me to make any comments about long-term impacts or chronic impacts or places where you have seasonal landscape fire smoke for months on end, which is with many parts of the globe. You couldn't be confident to say it's any less toxic than other sources. You know, there would be reason for concern there, but at this point, there's no data for me to be able to make a statement one way or the other. So that's a kind of a summary of smoke and where it is and what it does with respect to lung health. The theme of this session was greed and smoke. So just to finish with some reflections on that, greed, looking up what that might mean, selfish and excessive desire for more of something than you might need. And I guess really it's about human activity as it relates to fairness and it relates to personal enrichment versus the common good. And how does this relate to landscape fires and smoke? And I guess the key thing about fires, they're often thought of as natural. They're things, you know, our species has evolved with. And they're shaped by a lot of natural phenomena like rain and vegetation and ignition sources. But they're also hugely shaped by human activity. Humans have a huge influence on fire. So there's both nature and culture, but where humans have agency, then there's scope for greed and action that isn't in the common good, I guess. And a lot of actions associated with the more wealthy, industrialised nations certainly fall into this category in ways that has direct implications for fire. So invasion, dispossession, disruption of Indigenous traditional fire uses is a classic example of changing fire regimes in a way to make them less stable or increase risk of severe fires. Land clearance, deforestation, fires for commercial enterprises, loss of tropical rainforest for commercial enterprise is another example. And I guess the final example is the whole activity of industrialisation and greenhouse gas emissions and climate change, which has now set the biophysical world in a way that favours fire. And reflecting back on the distribution of smoke, I showed you the distribution of PM2.5 from fires. This is from that same study showing the distribution of estimated annual deaths associated with smoke from landscape fire. And we're talking more than 5 or 10,000 with the really per annum per pixel there in the darkest shades. But really what I want to point out there is the uneven distribution. It's hugely concentrated around Central Africa and Southeast Asia. And some of the societies driving the worst of the emissions are far less impacted. And then panning back from the global scene of impacts of landscape fire smoke, I come from Australia. We get a lot of bushfires. We always have. But our last season shocked us all. And this is a figure that shows the costs attributable to health impacts of smoke. So hospitalisations and deaths attributable to bushfire smoke in Australia by year for a 20-year period. And it shows our last season. And you can see that enormous column there right on the end, which was 10 times higher than the average of the previous 20 years. So we had a big season, totally unprecedented area burned and smoke for months and months, and a frightened population because of that. So it shocked us, but really it shouldn't, because if you look back at the global distribution of disease and the annual smoke haze experienced in many parts of the world and Southeast Asia, really what we had was a typical year for a large proportion of the world's population. So this slide kind of summarises where we're at in terms of fires and future trajectories, and the mismatch between, I guess, industrialised nations in particular that have been responsible for a lot of the commercial enterprises and sort of nation building activities that have led to huge emissions and deforestation. But we're now in a position where we've got a hotter and less stable climate, more droughts, ignitions and fire weather. So it's just conducive to more fires, full stop, but also to more extreme fires leading to disasters. It's also more conducive to fires in places that don't normally burn, like peat swamps that might dry out or be drained by human activity, and in wet forests and dense forests. And rainforest and peat, when that burns, you're actually releasing carbon stores that have been stored for hundreds, sometimes thousands of years. So that when you start burning those, you're making more smoke, you're releasing carbon stores, and you're contributing to more climate change again. So we're right at the beginning of this vicious cycle. So just in summary then, to conclude, landscape fires and smoke are shaped by human activity and human enterprise. So there's no question that values and resources and impacts come into that. Landscape fire smoke certainly contributes to the global burden of lung diseases and mortality, and that burden is unequally distributed between the higher and lower income regions of the world. And landscape fires are increasingly contributing to global carbon emissions. So historically, higher income countries have been spared or are able to avoid the serious consequences of their actions. And that doesn't lend itself to good corporate behaviour, the disconnection from the direct consequences. But it's probably overall a good thing that this is changing, and the amazing upsurge in severe fires and forest fire disasters in USA as we speak, in Australia last summer, in Europe last summer, in Chile, in the boreal forests recently. It goes from one unprecedented event to the next. So I guess I'll conclude by saying landscape fires and their smoke are an important determinant of health, and the picture is worsening. So I guess I'll finish by saying the common good is everybody's good, and the time to act is now. So thank you very much for listening.
Next. Yes, I have no conflict of interest. Next. Hello, and thank you for joining this session. I am Elvis Ndikum. I am a civic leader and the president of the Association for the Promotion of Youth Leadership, Advocacy and Volunteerism, Cameroon, APILAB. I am also an air health trainer with the World Organization of Family Doctors, WONCA, for Yaoundé, Cameroon. I was born in Smoke, I grew up in Smoke, and I live in Smoke. Allergic to environmental tobacco smoke, like from tobacco and other smokes, I decided to protect myself by getting engaged in protecting others. Today, I am a global advocate for clean air, striving to reduce the burden of air pollution on lung health. Next. This is the truth people around the world need to accept. There is no safe level of exposure to air pollution. Air pollution kills more than HIV and AIDS, malaria all combined. I got interested in lung health prevention when I noticed asthma was killing as many people, as well as HIV and AIDS and malaria and other diseases. But nobody around me was really talking about this, about asthma and the issue of living with asthma, which is related to having asthma issues, which will be hindering people from living a life with the disability. Surprisingly, mortality and morbidity from asthma due to exposure from air pollution can be prevented to a greater extent than other diseases. Next. It is true globally, air pollution kills more than 7 billion people annually, according to the World Health Organization. As we can see, children are most vulnerable, and children under 5, more than 600,000 die each year. Exposure to air pollution begins most of the time before birth. Women are exposed at home, both directly when they prepare, in most cases, burning biomass, solid fuels, and using kerosene stove, as well as from their husbands smoking cigarettes. And also, they will be exposed on the road when they walk on the roadside from vehicles, from polluting vehicles, and they will also be polluted in public places. This smoke is the smoke that affects both the mother and the fetus, and the child will be put to bed with breathing disabilities and challenges. So when they grow up, they will have to grow up with these challenges on their breathing and lung health. It is true there are laws around the world protecting people from environmental tobacco smoke and other forms of pollution, but countries are really, and people really don't respect them, as we can notice in most countries. Next. The health impacts of indoor air pollution. Children are most vulnerable. In most countries, in low and middle income, in most low and middle income countries, the use of biomass, solid fuels, and kerosene stoves is very frequent. And this is a major source of production of polluting particles, particulate matter, PM2.5, responsible for creating lung diseases. For example, in Cameroon, the government launched the liquefied petroleum gas plant in 2016, which is achieving some gains, but due to the cost, most families still turn to firewood, or what we call biomass solid fuels, and kerosene stoves, as we can see, for their livelihoods. And in the villages, they will only use firewood because this firewood is available at no cost. Next. Waste management is a serious problem in major cities in Africa. In Yaoundé, Cameroon, for example, the burning of waste is so common that when you walk on the streets, the waste are always being burned, which is really a major producer of pollution, of pollutants, which will not only exacerbate existing lung disease, but will lead to new onset of lung disease. So countries have to really take into consideration preventing in waste management and really banning this environmental smoke from waste. Slide, next. Indoor versus outdoor air pollution. Generally, indoor pollution from its sources, majority the use of biomass solid fuels, will stay indoor, while outdoor pollution will move into the house and into homes and settle down on the floors. We will notice that this pollution at the ground level is a source of pollution for children who are really at the ground level. They are always creeping. During my global data survey on breathing, health, and environmental risk factors in Yaoundé, with focus on asthma and allergies, parents and teachers confirmed their children were suffering from this type of pollution, thus making children very vulnerable, and they are very vulnerable because their lungs are still developing and they are always at the ground where the density of this kind of pollution is high. In the case of indoor and outdoor pollution, really hampering health at the level of, at the individual level, this pollution, this smoke moves into the atmosphere and contributes to greenhouse gases, which will lead to global warming and what we call climate change, and will result to droughts, floods, and we will have poor crop yields, as well as famine, which will also result in other aspects of other health aspects like hydric diseases and other issues related to cost at individual and infrastructure due to these floods related to climate change. Slide. Traffic-related pollution is also an issue in major cities in Africa, in Cameroon, Yaoundé in particular. As we can see, pollution from second-hand vehicles is really an issue. You will notice that these vehicles, they pollute not only the environment, but those walking on the streets and also those using other forms of transport. So, and this polluting smoke produces lead, nitrogen dioxide, and diesel exhaust, which is really an issue and will lead to lung disease, the creation of it will lead to lung diseases and also create other issues that will affect human health. So this pollution is really a big issue in major cities in Africa and in Yaoundé, Cameroon in particular. Slide. Solutions to combat air pollution are really necessary, given that air pollution is a silent and slow killer. Governments need to take air pollution as a serious issue, given that there are laws in countries, but they are rarely respected. As we can see, we need to be thinking of how to move from the use of biomass solid fuels into cleaner sources of energy, as well as transformation of proper waste management. Slide. Best practices in policy implementation. Uganda Tobacco Control Act 2015, first dedicated tobacco control law passed in July 2015, came into force in May 2016, mandates 100% smoke-free public places. Uganda passed its comprehensive tobacco control law, which actually had different aspects of it, having a law banning smoking in 100%, banning smoke in all public places. It is true Uganda has a low prevalence of smoking, which is like 10% compared to other countries, but 1.9 million Ugandans smoke, whom from 2016, they wouldn't be able to smoke in public places because of the law, which is a big win for environmental health and air pollution and lung diseases. Slide. Recommendation: patients, civil society, and healthcare professionals call to attention. The health impact of air pollution is taken seriously by individuals, industries, and governments. Evidence-based research needs to be encouraged to really explain the reality of air pollution impact on health. Also, we have to see into it that we ban completely, smoking, as well as in public places and at home, to reduce exacerbation of asthma and other lung diseases. Also, we need to see into it that the existing clean fuels for cooking, the prices should be affordable, and governments should ban the use of dirty fuels. At the level of transport, we need to consider land use should be very efficient by creating green spaces. Also, we have to take into consideration creating lanes for cycling while banning second-hand vehicles. At the level of waste, there should be waste management programs, which will also reduce waste in most countries, as well as banning open burning of waste. At the level of healthcare professionals should really think about advising their patients on how to take on mitigation actions needed to protect their health from air pollution challenges. At the level of air quality management, we need to take into consideration air quality monitoring, which will actually protect patients whom are vulnerable to be able to wear face masks or stay indoor, because pollution at some levels is not the same at all levels. So patients need to be very careful, or individuals at general need to be very careful the way they behave. Slide. Call to action. Governments need to take action in protecting the health of their citizens. Laws that protect people, especially laws that are enforced and compliance from air to prevent people from air pollution, are necessary. Air pollution and health should be included in school programs to protect children, especially at primary level, because air pollution is caused by everybody from children to adults. I urge governments and the World Health Organization to adopt a global fund for air pollution and climate change on health. Slide. Thank you for joining the session, and you are free to contact me either by email, on telephone, and to get more information or ask any questions. Thank you.
Hello, everyone. This is a panel discussion for plenary. I will start with Professor Johnston. How much forest fires and burning crops, Professor, contribute to the outdoor air pollution?
Yes, thank you for that question. I don't believe anybody has been able to do the global estimate specifically looking at the contribution, but there have been estimates of global burden of disease from air pollution that comes from forest fires, and following the same WHO methods of the global burden of disease studies. And probably at the global scale, it's around 10% of all deaths from outdoor air pollution might be attributed to smoke from landscape fires. But this is very uneven around the globe, and by far the biggest burden of disease is in areas of tropical rainforest, tropical savanna, particularly where there has been a lot of deforestation through burning the rainforests, which every year now cause massive air pollution in many parts of the world, South America, Central Africa, and especially Southeast Asia.
What is the environmental impact of this fire on the universe as a whole?
Yes, so it's changing, I guess is my answer to that. Normally, for example, in Australia, where I'm from, it's a part of the natural cycle to have fires in the vegetation. This is true of most forested areas on the planet. And the fires will come and then the trees will regrow. As they regrow, they will take in more carbon dioxide. And so overall, on balance, fire is thought to be neutral with respect to pollution and with respect to greenhouse gas emissions. But this is changing now for two reasons. One is the massive deforestation fires I just talked about, and fires in peatlands. These environments are usually far too wet. They don't historically burn. So now these fires are releasing carbon that has been stored for many thousands of years, and they're not getting taken up by regrowing vegetation because the land has been cleared for other purposes. So they're now contributing to the greenhouse gas emissions, contributing to a hotter climate. And of course, the hotter climate is making it much more favourable for many more fires everywhere. So places like Australia are seeing more fire disasters than previously. And it's becoming easier to clear tropical rainforests because they're drying out because of climate change. So we're beginning a vicious cycle, and the time to act is now, and it's become very urgent. And of course, this is just one of many environmental issues that we're facing now.
Thank you very much. I will move to Elvis now. You know, in the developing world and in most of the middle income countries, they witness a double burden of both, indoor and outdoor air pollution. How do you envisage strategies to combat that?
When we talk about burden, burden comes at two levels. The burden at the level of death and the burden at the level of living with the condition. So if we take air pollution indoors and outdoor, the strategy or the ways of living safely from air pollution, both indoors and outdoors, will be more related to preventive health. We need to think about preventive health again as a means of reducing the burden, because as we all know, lung diseases, air pollution, really responsible for lung diseases. Most of the causes are preventable. For example, if I take indoor pollution, which is mostly responsible by biomass solid fuels, as well as kerosene stoves and environmental tobacco smoke, we will notice that these are behavioral patterns which can be changed mostly by policy or awareness. So the best option for really curbing indoor and outdoor pollution in terms of burden will be at the level of prevention. We need to prevent these pollutants by switching from the dirty forms to the cleaner forms through mitigation action.
Thank you very much, Elvis. There are a lot of success stories throughout the world. And in indoor air pollutions, I feel that knowledge must be translated into local measurement. Premature deaths in China, for instance, when they shifted from coal to natural gas, diminished a great deal. How do you see these type of strategies in Africa?
Which is a pertinent question at the level of low and middle income countries in general. In Africa, in particular, pollution from indoors is principally through biomass solid fuels as well as environmental tobacco smoke. So when we look measures to switch from dirty to clean fuels, we think about, for example, Cameroon, where they have implemented the petroleum, liquefied petroleum gas plant in 2016, which is actually seeing some gains in terms of this is now available. But at the level of the cost, we need to think about the cost. How can we make this products available to the poor population or to the vulnerable population. We need to make policies or bring in policies that will make these products, cleaner fuels, to be available, as well as banning smoking indoor. In Africa, for example, we need to know people are not yet aware so much about the negative impact of air pollution on their health. So we need to bring in cleaner fuels or responsible behaviors through policy and a change of habits.
Do you think that indoor air pollution is a high priority with development partners? How can we make it a high priority for funders?
Indoor air pollution is not only a priority, but it's an urgent issue at the moment. Given the current situation, we need to take into consideration that people are now indoors a lot, and global partners need to know we need to invest in reducing the amount of pollution indoors, and this can only be done through providing funding and bringing solutions which are friendly, which are humanitarian, as I would say, because if we have to switch from dirty to clean fuels indoor, we need to think about policy, as I was saying, not only policy but also making the cost of these products should be reduced, as well as laws that ban environmental tobacco smoking at home. And also there should be some kind of compliance at the level of population. They need to understand these laws if they are available, and global partners need now to be doing everything that the homes should be clean. This is what I would say. We need to, it's an urgent issue, which given the current stakes of the crisis going on, we need to think about making homes to be clean, because this is where people will be at from now, and some point we don't even know when. So I think it's an urgent issue for global partners to invest in indoor pollution, especially in low and middle income settings. Thank you.
Thank you very much. That's great. Thank you. Let me move to Professor Vestbo, who talked to us about the new generation of tobacco and nicotine products. Are they harmless? Professor, in the ever-evolving debates around the novel products, knowledge regulation are the most, or are the first steps actually towards a legislative framework. Some countries, manage to do the ban effectively, like Australia, Canada, Brazil, Singapore, and others. Owing to the lack of safety and efficacy data, while ENDs remain widely available in the United States. And the UK embraced, the e-cigarettes as a harm, reduction alternative. What do you say to that?
I think there's very little evidence to support it being used in a harm reduction fashion. In fact, there is none. I think there is potential harm associated with all these novel products. And you could state that if you're a desperate smoker who has tried to quit using all the existing methodologies and still you haven't been able to quit your nicotine addiction, you may have a benefit from using these new products. But that's actually a niche of people. If we look at how they're marketed towards young people, as I showed in my presentation. It's very clearly using the same techniques as the tobacco industry, and I think we need much stricter regulation. And you're right, some countries have done it, but we've also seen attempts, for instance, in the European Union, where a country has tried to ban flavors in these new products, and they have failed to get it through, because there's a huge lobby working against further legislation, further restrictions on the use of these. So I think in many ways we have moved back to where we were with tobacco many years ago. And I think it is perhaps even more difficult because these are clearly not as dangerous as cigarettes. And I think the tobacco and vaping industry are using that very smartly against us.
Yeah, okay, we move through, that the long-term consequences of e-cigarettes have not, been widely studied. But there are consequences and there will be. In middle and low-income, countries, there are no specific, legal norms that apply to regulation and to content, even to emissions, to EN and NNDs so far. The additives are not explicitly regulated. And again, flavoring is used, and this attracts both youth and adolescents. How do you envisage, a strategy for this type of countries, low settings and middle income countries, like an early warning, strategy?
Yes, I think we should not wait for the long-term studies demonstrating the harm. We know it will be there, and if we are chasing the long-term evidence, we'll make the same mistakes as we did with tobacco. When I look at the studies that look at things that happen in airways of humans when you compare vapors with smokers, I see very worrying signs. It's the same inflammatory cascades that you trigger with vape as you do with smoke. So in my view, there's no doubt that there is a long-term risk. We don't quite know the size, but it's definitely there. And I think for that reason, it's not about regulating a few of the contents in the e-cigarette juice. It's not about getting rid of one chemical and substituting with another chemical. We know that all these substitutes and all these different chemicals, they change when you heat them. So you don't even know if what's on the list of ingredients is what you inhale. So I think it's not about making restrictions on contents. It's really about making sure that we protect children and youth against the use of them. And I think that only comes through bans and restrictions on who can buy them, just like cigarettes. I think it is terrible that you can have countries where you cannot buy cigarettes if you're less than 18, but you can buy e-cigarettes, e-cigarette juice, you can buy Juul products, you can do everything that will make you just as nicotine addicted as if you bought cigarettes. So I think it's about legislation that protects youth, and I think we should see it as child protection. Also in low and middle income countries, this is actually protecting children against long-term harm. It's not about regulating ingredients.
Thank you very much, Prof.
Thank you.